As a mother, I urge you today to reach out to your child's healthcare provider to make an appointment to get your children and adolescents caught up on these life-saving vaccines.
The founder of the I Vaccinate campaign, Veronica McNally, gathered health professionals from around the state today to urge parents to get kids vaccinated against preventable diseases.
As things begin to open up, as we get more people vaccinated for COVID and people start traveling and moving, we will see an increased exposure to vaccine preventable diseases.
The MDHHS Immunization Program Director shared vaccination rates for kids 19 to 36 months have fallen below 70% in more than half of the state, signified on this graphic by the colors pink and peach. That threshold is the most common for some diseases, but for measles, health officials want that rate much closer to 100.
In order to achieve the herd immunity we need to prevent measles from spreading, we need to be at least 90% and really above 95%. So we are about 20% lower than where we need to be.
Kent County is still sitting in the 70 to 80% range, but a drop-off in child immunizations is something the health department has been monitoring since the summer, when they shared a large amount of not only toddlers, but teenagers 13 to 17 were behind in their shots.
Other states have had huge issues with measles outbreaks, and we don't want to see that happen in Michigan nor in Kent County.
Swanson says we're making progress against COVID-19. 1 in 4 Michiganders 16 and up are now fully vaccinated, but a concern for other preventable diseases must also remain a priority.
So great progress, but now we need to make sure we focus on the routine childhood immunizations as well to prevent those diseases from happening.